close to the end of the term here. This is our second to last module, and I'm so excited. It is a topic I'm sure everybody is very familiar with right now: stress and burnout. So, I kind of wanted to start it with something super light and show you a clip of, oh, you know what? I'll wait to show my clip. We're going to start with, what is stress? Stress is any demand that is placed on a system or perceived threat to an organism. It is a psychological and physiological response to events that upset our personal balance in some way. I used to think that stress was just something that you mentally experience, and it doesn't really have a huge, profound effect on your physiological health, more so your mental health. But now that I'm learning a little bit more about the pathophysiology of diseases in the body, it's amazing to me how much stress actually does contribute to chronic illness, especially heart disease. It places you at higher risk for coronary artery disease. There's just a lot of things that stress contributes to negatively in your body. So, you know, when you're younger and people are meditating, or you think it's stupid. You really do. You don't think that it's that important. You don't think that there's that much stress in the world that that's something that you need to do, when in reality, hindsight's always 20/20, and the older you get, the more you realize that, like, your parents had it figured out. So meditating is still really cool. Is cool now to keep your stress low. Anyways, that's just an example of something that I guess I do to maintain my stress. I always think about meditation and how much I used to think it was the stupidest thing. And my sister-in-law even, okay, it's not stupid, but I just didn't feel like it was very helpful, because my brain would just wander constantly and I would just be sitting there. But I've, in my older age, come to really appreciate it. And my sister-in-law recently even suggested doing acupuncture for stress relief, and I thought that would be really, I never in my life would have been open to that idea until 2020. So here we are, and I am open to acupuncture because our lives are stressed. Stress as a biological function. So when you think of fight or flight response, I usually think of, in the middle of the night, you're running to take something out to the garbage, or it's dark, and you hear noise, and automatically, like, everything in your body is awake and ready to fight, right? That fight or flight response. It's meant to protect us. That's its original function, is to keep our body safe from some sort of impending threat. So it's been passed down. It's a, what's the word where it's been passed down through evolution. Essentially, it's been a means to be able to keep the human race going. But unfortunately, with so much stress, our bodies don't recognize the difference between a fight or flight response in a moment of stress, when we need our fight or flight response to survive, versus consistent stress all of the time, where we're living in this fight or flight response. That's when it becomes dangerous, and that's when our bodies start to see physiological effects, negative physiological effects from these stress-triggered fight or flight response lives. Like, we're just living in that zone. Here are some effects of stress. I talked about the emotional aspect and the mental aspect of it, but there's also social and behavioral aspects of stress, as well as physical aspects related to, like, the physiology in your body. Here are some examples of how stress does affect the physiology in your body. Your heart rate increases, blood pressure increases, you have an increased sweat production, you have an upset stomach, decreased immune response, breathing increases, headaches and muscle aches, insomnia, skin breakouts. I think those are just to name a few. I think there's a lot that also can be added to that list, because a lot of people feel stress differently and it affects their bodies differently. I can think specifically, like, of little children when they're stressed, when they're mentally struggling or emotionally struggling, at least for like my little guy and just kids that I've known, their stomach will hurt if they're worried about things. That is a form of stress that's being manifested physically in the body. Some people get headaches. I carry like a lot of stress in my neck. I can feel it when my neck gets super tight. Like I'm probably stressed about things in my life. No one wants their sweat production to be increased. But you can also get sick. You have this decreased immune response, and you can get sick more from being constantly stressed. There's a teacher in the respiratory program who is always telling us, I want you to study for this test. I want you to make sure that you're ready and prepared for clinical. But more importantly, I want you to make sure that you're getting sleep, and I want you to not get sick. I want you to take care of yourself so you're not getting sick. I don't want you to be too stressed so you're not getting sick. Like, that's his mantra all the time, is try and keep your stress level down because I don't want you to be getting sick. He's a really neat guy, but he's very in tune to the fact that stress causes physical manifestations in the body as well. Moving on, emotional manifestations of stress. You become very irritable, depressed, apathetic, moody, apprehension, just apprehensive to decisions or change, restlessness, agitation, feeling overwhelmed are all feelings that can happen when we are stressed. Socially and behaviorally, you neglect responsibilities, procrastinate, you isolate yourself, you eat too much or you don't eat at all, you sleep too much or you don't sleep at all. You overreact. You use drugs or alcohol to try to cope with that stress. You try to fit in as many things as you possibly can to try to combat that stress so that you're not thinking about it. Shopping, exercise, whatever that activity may be. And then some people even have like nervous habits where you are biting your nails or you're pacing. I have a weird habit of peeling my lips. There's all kinds of things that socially and behaviorally social and behavioral effects take place from stress as well. It's really interesting living in this day and age where I feel like the majority of the population is stressed right now, trying to live through this whole COVID pandemic and not knowing what the future might look like and this new normal. It's been interesting just to see how people cope with this stress in their life. I appreciate the fact that people are outside more. Like you look out your window and there's people constantly walking in the neighborhood or getting out of their house, and that I think is a form of healthy way to combat stress through exercise or whatnot. But like it says here, too much of a good thing is still not a good thing. So over exercising or over investing in those activities can be a bad thing too. Mental effects of stress. You become absent-minded, unable to concentrate, you're indecisive, you have a cloudy mind, you're worrying constantly, you have poor judgment. All of these things go hand in hand, and I just want to point out that I feel like this is kind of very rudimentary lecture. Like, a lot of these things are just common sense, but for those who don't understand stress as well, it's usually not just one of these things. You may have symptoms mentally from stress and socially and behaviorally, and you might experience physical symptoms as well. It's not usually just one thing. One leads to another, which leads to another, and you're struggling at the end of the day. So not just in that one area. I just want to point that out. So let's talk about typical causes of stress. Causes of stress are very individual. They come to every person in a different way. Something that stresses my husband out, for example, wouldn't stress me out in the same way. Or, that can go for all of us. Some things that stress other people out may not stress you out. But it is very individual, so it's difficult to point out what exactly causes it. But some examples that are given would be major life changes, whether they're positive or negative, marriage, divorce, starting or finishing school, birth, death of loved ones, and starting or quitting jobs. Those are usually the big things that people have happen in their life. But most commonly, stress is caused by the buildup of these small little everyday tasks that just end up adding up. You have just this constant stress of little things at the end of the day can sometimes have a greater effect than maybe a stressful event that was stressful for a while and then was gone. So learning how to cope with stress on an everyday level, I think, is equally as important as learning how to combat stress in these major eventful situations. There can also be environmental causes that result in stress: pollution, noise, uncomfortable living conditions, unsafe environments, etc. This is cute, Sherry. She is one of the teachers in the respiratory therapy program. Causes of everyday stress. Everyday stress can also include family and relationship causes. Whether it's good stress or bad stress, it's the nature of the beast when you have relationships that you're so invested in that conflicts will arise. You'll disagree with certain things. You'll worry about health, or you'll want the success of people. Even if that's a good stress, it's still stress on your body. So family and relationships can be a particular cause of stress, whether they be good or bad. Work causes of everyday stress. This is a pretty important topic in the work-life balance today in healthcare. Working in healthcare is a stressful job. You're taking care of people's lives. You're trying to do it in a way that follows very specific rules. You don't want to be hurting anybody. You don't want to be doing anything wrong or illegal or wasting of resources. You want to do right by your patients. And usually those patients are in stressful situations themselves with their health they may not have good health, or you're dealing in an emergent situation. Working in a hospital is incredibly stressful. So you have that, the work environment stressful, and maybe a home environment stressful, and then 2020 has been stressful, and you can see that those things start to add up in a day-to-day experience, and your body kind of takes the hit for that. You also have social causes of stress, where you're financially stressed, you're worried about making enough money, you may not be working right now, which is stressful. Like I said, every person is affected by different things individually that relate to stress in their life. So, teamwork, right? A few harmless flakes working together can unleash an avalanche of destruction. Look at that. All right, so internal sources of stress. I think this is this relates back to this emotional and mental stress. People who are really hard on themselves, especially when you're in school and you have this high expectation of yourself. You want to be successful in your classes. You want to be successful on your exams. You want good grades. You want a good GPA. There's a lot that's riding on this, and not to mention it's a huge investment financially. So you want to feel like you're getting your money's worth, So internal sources of stress, that just being critical and hard on yourself. Low self-esteem can be a problem. Worry, anxiety, unrealistic expectations, pessimistic attitudes, perfectionism, self-criticism, and lack of assertiveness are all internal causes of stress. So, these are some of the diseases that over a long period of time stress contributes to: chronic pain, ulcers, migraines, irritable bowel syndrome, heartburn, high blood pressure, heart disease, diabetes, PMS, obesity, etc. There's all these cute little motivational posters. I picture them in your PE class when you're in high school. These would all be on the locker room wall. Pressure, it can turn a lump of coal into a flawless diamond, or an average person into a perfect basket case. So how do we deal with it, right? 4 stress relief techniques: breathe, exercise, refrain, meditation. So I want to show you my funny little clip. Let's see. I hope that most of you are familiar with The Office. So we're going to start out with a nice example of what Michael Scott thinks are the best ways to relieve stress.
Everybody sit on the floor, Indian style like me. Oh my God, if you're wearing a dress, please keep your knees together. Nobody wants to see that. My goal is to make this office as peaceful a place for Stanley Hudson as I can. I think sounds have a lot to do with that. Here are some downloaded peaceful sounds. beautiful sunny day as we walk through the meadow that is very spiritual and relaxing, and there are flowers, and it is sunny and beautiful.
So there you have it, Michael Scott's view of the best ways to combat stress in the office. Meditation, relaxing sounds, walking over everybody, holding a candle, dropping wax on their face, whatever you gotta do. You gotta deal with stress. So back to the lecture. Breathe, exercise, refrain, meditation. Those are just, I feel like, some examples. I think there's a lot of other things that also can be added to the list. And like stress affects everybody individually, there also are certain things that alleviate that stress that are individual to each person. So these are just some examples. There are lots of things that can help you alleviate stress, and I think that's the most important thing for you to figure out. What works for you? What brings your heart rate down? What helps your mind stop racing? What allows you to rest and have a break? So, breathing increases oxygen to the brain, it increases circulation, it helps you to focus, and it slows you down. That whole breathing in through your nose and out through your mouth, that's an important practice. I even teach that to my 5-year-old and my 2-year-old right now. Like, they're freaking out. He's having these crazy massive temper tantrums, or my 2-year-old's freaking out and she's crying and hysterical, and I can't get through to her. She's 2 regardless, so I can't get through to her anyway. But if she's having a full-blown temper tantrum and I can get her attention enough to tell her, okay, breathe, like, take a breath, calm down. It works for 2-year-olds, it works for 5-year-olds, it works for 35-year-olds. Breathing helps to calm your stress level, and it helps to increase this oxygen to your brain. So physiologically, breathing is really helpful in these stressful situations. Exercise, this is one that I love for stress. Produces endorphins, so those feel good hormones, I think they're hormones that run through your body. It reduces depression, makes you feel better about yourself and life. 30 minutes to 1 hour a day. So I really noticed a difference, at least in my life, in how I can handle stressful situations. It's directly proportional to how much I have made an effort to move my body, really. If I am in a habit of regularly exercising, I feel like I handle things much better. I'm much more patient with my kids. I am better with the stress of school and of life. But if I am not exercising and I'm just sitting at home, I'm not moving my body, I'm eating crappy, like, I feel like things just pile on top of me and I start to feel like I'm being suffocated. Like, I can't deal as well with life. So I especially appreciate exercise for combating stress. Refraining, taking one thing at a time, thinking positive, and focus on each task at hand individually. So it lists, I like this picture because it gives a list. Lists are good. Just to write it down and get it on paper, like all the things that you're needing to accomplish. I also want to add to this I said refraining, but it's actually reframing. But I want to add reframing as well. I think one of the most effective things that somebody told me is that taking care of yourself, it's okay to say no. Like, it's okay to put yourself first and to say no sometimes. So you may need some reframing in your life, focusing on priorities and what's most important to get done that day and letting the other things happen or not happen. But it's also important to say no. And if you have to say no to take care of yourself, that's especially important. You can still love somebody, you can still be compassionate and helpful, and say no sometimes. So if things are stressful and piling on, and your body is feeling tired, and your mind is feeling tired, and you're taking on too much, helping to weed those things out, I think, is especially important. To put your health first, and your mental health, your physical health first, and just do those things that are of the utmost importance and kind of let the rest fall to the wayside until you can handle more. And that's okay. Sometimes in life you can handle more and sometimes you can't. And it's a season, and in this season you might be able to handle something that you can't in the next. So you got to take it as it comes. Meditation. I totally used to make fun of people who meditated. Like, I feel like in TV it was portrayed as just a bunch of hippies out in a field by a tree. They're meditating, they're talking to trees, and now I get it, so I feel stupid. But I love meditation. I feel like being a mom and a student and a recovering perfectionist, I've had to learn how to help my brain just slow down. I feel like sometimes it's just hard to turn your mind off, even when you get in bed and you're thinking about the 4,000 things that you have to do the next day. Meditation is an opportunity to sit down and to just give your mind a little bit of a break. It slows your heart rate, so physiologically it calms things down, it lowers blood pressure. It too produces endorphins like exercise, and it helps to clear your mind of distractions. So I feel like it just kind of gives you a clean slate, like it wipes the brain of all of your open tabs and helps you to just kind of take things one at a time. So meditation can be a really useful tool when combating stress. When stress isn't combated, is that a word? Combated? In the workforce especially, this topic that we're going to talk about happens called burnout. And it's also very common in the healthcare profession. Burnout is a state of emotional and physical exhaustion that is caused by excessive and prolonged stress. It causes a loss of motivation, and it reduces productivity and saps your energy. So there's a difference between having like a bad day at work and hating your job. There's a big difference. Having a bad day at work, you can go home and debrief and take a break and go to sleep and start again the next day and be okay. Hating your job affects everything that you do in your life. You hate your job, you come home, you're grumpy at home, you don't sleep well, you wake up, you're not motivated, you don't want to go to work, but you have to anyway, and it's just this constant cycle that in the long run can have some serious effects on your physiological health. So here's our another locker room poster. Burnout. Attitudes are contagious. Mine might kill you. Catchy, right? Signs and symptoms of burnout: powerlessness, hopelessness, emotional exhaustion, detachment, isolation, irritability, frustration, being trapped, failure, despair, cynicism, and apathy. So, stress and burnout are two different things. Stress is characterized by overengagement, and burnout is the opposite. It's characterized by disengagement. In stress, emotions are overreactive, and in burnout, you don't care. There's no emotion whatsoever. Stress produces urgency and hyperactivity, just this feeling of, oh my gosh, I have to do it right now. And where burnout is just this, I can't control anything. I'm not going to do anything anyway. Like, there's no reason to do it. Just this hopelessness. That anxiousness is not there. It's moved on to this I don't care anymore type of a thing. In stress, you kind of have this loss of energy, where in burnout, you have a loss of motivation, of your ideals, of hope. Stress leads to anxiety disorders, where burnout leads to detachment and depression. Stress, the primary damage is physical, where burnout, the primary damage is emotional. So you're really affecting two different parts with stress and burnout, and I don't think that, what am I trying to say? I think that it is not uncommon to have both of these in different areas of your life too. You may be stressed at home and burn out at your job, or you may be burnt out at home and stressed at your job, or maybe you do have just one or the other, but it's not impossible to have both of these at the same time. Stress may literally kill you. Like it may kill you prematurely, where burnout may make life seem like it's not worth living, which could lead to depression. It can lead to all kinds of things of worthlessness, and there's a lot of people who have taken their own lives because of that feeling. So I think that you could also add to the list that burnout can also take your life. So, major takeaway from all of this is that dealing with stress and learning how to make healthy coping mechanisms in your life a priority is not only crucial for success in the healthcare profession, but I think success overall in your relationships, at home, just your success as a contributing citizen to society. It is important to know how stress can be combated in your own life, how personally you are able to alleviate that stress. Here's some examples of job burnout, like I talked about. Every day at work is a bad one. Caring about work seems not worth the effort. Tasks at work either seem mind-numbingly boring or unpleasant, or you feel like nothing you do makes a difference. So looking at each of these examples, in the healthcare profession, we're not working on robots. We're not working on machines. We are working on people who need you to show up for them, right? Who need you to show up, and they're depending on you. And not just in your knowledge, but a lot of the time in your personality, in your hope. And when you show up to work and your attitude is that every day at work is a bad one, that translates over to your patients. When you're caring about work seems not worth the effort, that also transfers over to your patients. Not worth the effort, like, you're caring about human beings here, and if you feel like taking care of human beings is not worth the effort, then you're probably suffering from burnout and you probably need a change of pace. If your tasks at work seem mind-numbingly boring or unpleasant with human beings, that also is a huge sign that you might need to switch things up a little bit. And when you feel like nothing you do makes a difference at work, especially with human beings, that also should be a big indicator that maybe you need to do things differently or talk to somebody, your supervisor. Maybe you just need to start doing something a little bit differently. I think the next one gives examples. Yeah, ways to prevent burnout at work. Clarify your job description if you feel overwhelmed, and refine your scope of practice. I remember in clinical one time, I had a preceptor who I was following, and I was like this little bubbly, like, respiratory therapy student, like, I'm ready to help for it with anything and everything. I'll do whatever you need me to do, you know. And this therapist was like, we do what is within our scope of practice, and some days that is a lot, and you're running around like a chicken with your head cut off, doing all of the things that are required of you within your scope of practice. And then there are days where what is required of you in that scope of practice is not as much as maybe somebody else. And in this specific example, there was a nurse who was struggling with something IV related or whatever. I can't remember specifically, but my thought was, well, why don't we stay and help her? You know, like, we have a minute, we're not super busy or whatever. And while that was kind, I think that you have to be careful, because you do have to work within your scope of practice. You don't want to get in trouble, obviously, but you also have to set boundaries with yourself and with those around you. And yeah, basically what I'm trying to say is working within that scope of practice is a safety net for you to prevent burnout, but also to keep your patients safe, make sure you're working legally and you're not going to get in trouble by doing things. Working within your scope of practice can be a really critical area for preventing burnout. And that was what that preceptor told me, essentially, was that, you know, today is a slow day and I'm going to take it slow. And my thought was, well, maybe you're just being lazy or whatever. But I think there actually was a little more wisdom there in his many years of being a respiratory therapist that he knew that I didn't know yet. So I appreciated his example. Another way to prevent burnout: request a transfer or move to another type of workplace. This might be a new hospital, this might be a new shift, this might be a different floor. There are so many opportunities in healthcare to be moving around. So if you're not happy where you are, whether it's the patients or the staff, change it. You don't have to be stuck in some terrible position that you're not happy in. There are a lot of different areas that you can go and work. So talk to somebody. Don't suffer in silence. Don't let your patients suffer because you don't want to be there. Like, fix it for yourself. Go in and talk to somebody and change what you're doing. Ask for new duties to shake things up. I was thinking about this one, and I wasn't quite sure what I wanted to say. Maybe new duties that fall within that scope of practice. And I think the idea here is that maybe learning new things is a way to prevent burnout, but just asking for more, I don't think helps prevent burnout. So maybe just the monotony of the day is what's causing your burnout, and switching up your task. Like maybe you want to learn how to put in art lines, or you want to learn how to perform an EKG. Like that's a way to switch things up that works within your scope of practice. But if you're just taking on more on your plate when you're already stressed, I don't think that is that's not going to help prevent anything, but it's going to contribute to your burnout further. So that one I think you just kind of have to take with a grain of salt. Take time off and breaks at work when you need them. You can't take care of anybody else successfully if you can't take care of yourself. So making sure that you are taking breaks and not feeling awkward about putting yourself as a priority. I think that's important too. That can be kind of tricky and it can be kind of awkward, but when you have a minute to give yourself a break, take it. Don't try to prove anything to anybody. Take care of yourself, because you can't take care of anybody else if you're not okay, if you're not in a safe and healthy place. And not taking breaks and not eating and just going a million miles an hour all day long every day is not an effective way to take care of patients or to take care of yourself. So in closing, there's this cute little meme. It's gotten to a point where I am working here to pay for the prescriptions I now require to cope with working here. So things have gotten real out of hand for this poor guy. But just in conclusion, I think we all can point out different areas of stress in our life, and while I don't think we place enough emphasis on the fact that stress contributes so much to our bodies physiologically and causes these negative effects, it's important to be able to find those coping mechanisms that are healthy to be able to decrease as much stress as possible within reason, right? There's a lot that we can't control right now, and it's okay to be stressed about some things. I want to acknowledge those feelings. Like, stress is normal, and it is a feeling that needs to be felt, but it is something that can be proactively managed as well. And in doing so, you not only take care of yourself mentally, but also physically, and you help to have a healthy lifestyle that's not going to contribute to pathophysiology down the road. So that will conclude our lecture. I wanted to point out there's a couple things on the module for this week. They are stress tests. So you can click on the link. If it doesn't open up, there's where'd it go? This also applies to the lecture videos. I know somebody was having a hard time opening up the video last week, and that was my bad. I'm sorry, the link wasn't working. But let's go down to where we are. Here we go. So, how stressed are you? You can click on this, and it should pull up in a separate page, and you can take this test. So you add a number to each of these situations, and at the end of the page, you add up what your total score is, and based on what your score is, it will put you within these different categories, and you can see what your likelihood of stress is, how you're managing it, whether you have a high degree or moderate degree of stress, etc. And that can kind of just give you like a numerical value of, oh yeah, maybe I'm a little more stressed than I thought I was. So that is, let's see, that's the how stressed are you, and then there's another one that is the stress test right here. This one I think was the one that was tricky to open up. Yeah, so it doesn't pull up right here, which can be a little bit confusing, but if you click on the stress test here, it should pull up in a separate tab, and you should be able to go through, and it's kind of similar as the other one. I think these are really interesting. It goes through and it gives impact scores specific to these life events. So it already adds, if you've had a personal injury or an illness, it automatically gives you 53 points. And, that goes for each of these different categories. And at the end of it, you add it all up. And it also, you add up your score, it gives you a certain score, and then whichever category you fall within, it shows you the likelihood of illness in the near future. So if you have a 300 or plus life change units or score from up here, it says that you have an 80% chance of a likelihood of an illness in the future. That's a pretty high score. It's a pretty high percent. 80% is a pretty high percent. And especially with this pandemic, like, the best thing I think that we can do is to take care of our health right now, and reducing stress clearly can help in that. So if you're reducing stress and you don't put yourself to be predisposed to illness, I think that can contribute to keeping yourself healthy during these times and just in general. But that's it for this week. I hope everybody is doing well. If you have any questions, or if the link isn't working, or if you need some help with a stress test or whatever, or your stress paper, let me know. You can email me or you can email Heidi. But yeah, have a great week, and we'll talk to you later.